Acute viral hepatitis. Important clinical features: vomiting, fever, jaundice, and tender hepatomegaly. Overall clinical manifestations. Asymptomatic, in anicteric, and icteric in classical presentation. Asymptomatic, only rise in serum HGBT. Asymptomatic, only rise in serum HGBT and HGOT. Anicteric, patients have no jaundice. But suffer from anorexia, nausea, vomiting, and influenza-like symptoms. Anorexia, nausea, vomiting, and influenza-like symptoms. Classical presentation occurs in three phases. Prodromal phase, icteric phase, and recovery phase. Prodromal phase. This phase precedes the icteric phase by 1 to 2 weeks. This phase precedes the icteric phase Prodromal phase. This phase precedes the icteric phase by 1 to 2 weeks with non-specific symptoms like malaise, anorexia, nausea, vomiting, fever, myalgia and arthralgia. Icteric phase, prodromal phase, icteric phase, and recovery phase. Icteric phase. This phase characterized by yellow sclera, tender hepatomegaly with right hypochondriac and epigastric pain. Stool often turn pale. Urine becomes high colored. Stool often turn pale, and urine becomes high colored. Then recovery phase. In this phase, constitutional symptoms disappear, but some hepatomegaly and biochemical abnormalities persist. Diagnosis based on clinical features and relevant investigation. Investigations: liver function test, serum bilirubin, HGPT, prothrombin time, alkaline phosphatase are elevated. Viral markers: anti-HAV, immunoglobulin M, liver function test, viral markers, and ultrasonogram of whole abdomen. Viral markers: anti-hepatitis A virus, immunoglobulin M, anti-hepatitis E virus, immunoglobulin M, HBs antigen, anti-hepatitis C virus. Treatment counseling. Then ultrasonogram of whole abdomen. Now treatment. Counseling the parents about the natural history of the disease. There is no specific treatment. The treatment is only supportive. It includes rest, diet, vitamin K, and purgatives, gut sterilizers, or lactulose. Rest. Outdoor activities should be restricted as far as possible, but forced and prolonged bed rest is not essential. Diet. Normal diet. High calorie diet is desirable. Traditional low fat, high carbohydrate diet has no beneficial effect. IV fluid may be required for cases with persistent vomiting or those who cannot tolerate oral feeding. Vitamin K, it is considered if prothrombin time is high. If prothrombin time is high. Purgatives, gut sterilizers or lactulose. No therapeutic benefit in uncomplicated cases. No therapeutic benefit in uncomplicated cases. Most likely diagnostic. Most likely diagnosis: acute viral hepatitis, liver function test, serum bilirubin level raised, ALT elevated, ALP not so elevated except intrahepatic cholestasis. Increased in intrahepatic cholestasis. Prothrombin time usually normal, may be raised in hepatic failure or intrahepatic cholestasis. May be normal, raised in intrahepatic cholestasis and hepatic failure. Serum albumin usually normal. To identify the cause of viral hepatitis: anti-hepatitis A virus immunoglobulin M, anti-hepatitis E virus immunoglobulin is this antigen, and anti-hepatitis C virus. To see the hepatic ecotexture, prevention of acute viral hepatitis. Prevention: general and specific. Improving personal food and environment hygiene. Improve personal food and environmental hygiene. Improving personal food and environmental hygiene. Avoiding unnecessary needle pricks. Using disposable syringes and screen blood transfusion. Improving personal food and environmental hygiene, avoiding unnecessary needle pricks, using disposable syringes, screen blood transfusion. Specific prevention: immunization against hepatitis A, B according to EPI schedule. Hepatitis A and B according to EPI schedule. Now complications of acute viral hepatitis. Immediate complications: acute liver failure and hepatic encephalopathy. Prevention of complications: avoidance of hepatotoxic drugs, avoidance of sedatives and hypnotics, maintenance of proper nutrition. Acute viral hepatitis. Important clinical features: anorexia, vomiting and fever, jaundice and tender hepatomegaly. Clinical manifestation: asymptomatic, anicteric and classical. Asymptomatic in only rise in serum HGPT and HGOT. Anicteric phase: patient have no jaundice but suffer from anorexia, nausea, vomiting and influenza-like symptoms. Classical presentation occurs in 3 phases: prodromal phase, icteric phase and recovery phase. Prodromal phase is phase by 1 to 2 weeks with non-specific symptoms like malaise, anorexia, nausea, vomiting, fever, headache, myalgia and arthralgia. Icteric phase. This phase is characterized by yellow sclera, tender hepatomegaly with right hypochondriac or epigastric pain. Stool often turn pale and urine becomes high colored. Recovery phase. In this phase, constitutional symptoms disappear, but some hepatomegaly and biochemical abnormalities persist. Some biochemical abnormalities persist. Investigations: liver function test, serum bilirubin increased, HGPT, prothrombin time usually normal but increased in intrahepatic cholestasis and hepatic failure. ALP increased in intrahepatic cholestasis and ALT usually increased. Viral markers: anti-hepatitis A virus immunoglobulin M, anti-hepatitis E virus immunoglobulin M, HBs antigen, anti-hepatitis C virus, and ultrasonogram of whole abdomen for echo texture of the liver. Treatment: counsel the patient about the normal history of the disease. There is no specific treatment. Treatment is only supportive. It includes rest, diet, vitamin K, and purgatives. Rest. Outdoor activities should be restricted as far as possible. Diet normal. High calorie diet is desirable. Traditional low fat high calorie diet has no beneficial effect. IV fluid may be required for cases with persistent vomiting or those who cannot tolerate oral feeding. Vitamin K is considered if prothrombin time is high. Purgatives, gut sterilizers or lactulose not therapeutic benefit in uncomplicated case. Prevention, general and specific prevention. General prevention: improving personal food and environmental hygiene. Avoiding unnecessary needle pricks. Using disposable syringes and skin blood transfusion. Specific immunization against hepatitis A and B according to hepatitis A and B. Complications: immediate complications, acute liver failure, hepatic encephalopathy. Prevention of complications: avoidance of hepatotoxic drugs, avoidance of sedatives and hypnotics, maintenance of proper nutrition.